Golf Training Hacks. Worried that your golf swing might be causing some back injuries? Well, you should be worried because the golf swing does cause back injuries. You know, it's a high velocity rotation that puts a lot of force into your spine. So right there, it's going to cause some injuries even under the best of circumstances. So we want to put our backs in the best position possible to buffer the forces of a golf swing. Now, unfortunately, a lot of us are doing this all day. We're sitting. And sitting can disrupt your posture. So in this video, we're going to talk about something called lower cross syndrome, and it occurs in your hips. It messes up the alignment of your hips because when we sit all day or do anything that's habitual or chronic, whether it be stationary or with movement, your body adjusts to it and your body adapts to it. So in this case, when we're sitting too much, our bodies are adapting to this position. What happens is your hip flexors get too tight. Now, a hip flexor is called the psoas muscle. It's attached to the inside of your thigh. It goes over your pelvis, and then it attaches into your vertebrae, your lumbar vertebrae. So when you're standing up, when these hip flexors get too tight, what happens is you go into what's called anterior pelvic tilt, where instead of your pelvis being in the neutral position and your spine being, your lower back being in a neutral extension, your pelvis tilts forward and your spine goes into a little bit more extension than it should. That's because these hip flexors get tight. It's kind of like if you grabbed your pants and tried to stand up, you would be pulled into extension in your lower back. So that happens here. And while you're in extension here, what happens to your lower back is that the paraspinals get, the muscles right around the spine and other muscles in this lower back get stiff. So you have stiff and tight hip flexors pulling your vertebrae, lumbar vertebrae that way, tilting your spine that way, and you have tight lower back muscles. That's one leg of the X. The other leg is the abdominals and the glute max. These become weak. So you have hip flexors and lower back, you have abdominals and glute muscles. So there's the X. So when you're sitting all day, these get weak because your back, the back of the chair is replacing your torso muscle. So you're always sitting, or worse yet, slumping. And these get weak, and you're sitting all day, so there's no input in here, so that weakens your glutes. Now, do you think you sit a lot? I mean, if you sit more than 6 hours a day, you're considered sedentary. That's not hard to do if you have a job at a desk. You have a job at a desk, and then you commute, let's say, a half hour, 45 minutes a day in your car, and you're probably sitting 6 hours a day. When you have your lower back in extension, the lumbar spine, and you have your pelvis in anterior pelvic tilt, it makes it harder to rotate from the hips, but it also puts a lot of stress on your lower back because you want just a normal baseline amount of extension in your lower back. So yeah, the golf swing heightens back injuries, but if we have good posture and we work on creating good posture and getting to that baseline neutral spine, then you can mitigate some of the risk of that high velocity rotation. One of the things that you can do is not sit so much. Easier said than done, I know, but that's one of the ways that we can begin to reduce some back injuries in golf and get our spine posture in that nice neutral S that we've talked about a lot in Golf Training Hacks. So thanks for watching. I hope that's helpful, and we look forward to seeing you in upcoming videos and lessons.